there's always challenging aspects because there's not enough resources, or there's not the right resources. There's people that fill in that gap. If they have money, they can get this, and that resource. If they don't have money, they can get this and that. But if they're right in between, not enough money, it's really frustrating trying to find the resources. So that's part of the frustration, and I wouldn't say negative, but just the frustration, because I think you find that in any service-oriented job, whether you're a nurse in the hospital or an APS nurse or whatever, you're going to have those kind of frustrations. And yes, sometimes it gets stressful because we get weeks where we have lots and lots of referrals, and those people need to be seen. And so when you get overwhelmed, you just need to reach out to a colleague, reach out to your supervisor. They don't throw you in the deep end in the very beginning. I mean, they slowly give you cases, and you learn to do the cases. You're also going to be the worker of the day, which means if there's an emergency one that needs to be seen right away, you're going to have to go out and see them. And you will inherit that case once you've gone out and seen that person. So if you're looking for a job where it's smooth sailing, this is not the job. You have to be a problem solver. You have to think critically. You have to see what the resources are. You have to pull families in if there's families available, and explain to them that what the situation is and how to help their family member. And that's not always easy, because you have kids who, they just want the house when mom or dad passes. And so it's really difficult sometimes and frustrating, and you can get angry at family members and community members that are demanding instantaneous. And because we can't make it happen, you get a lot of people that are upset that we couldn't force this person to go to a nursing home, or force this person to take a shower more than once a week, or not wear their holy pants and stuff and walk around. So it can be really frustrating, but it gives you an opportunity to be extremely creative. You have all these community resources and work together to find answers for these people. And sometimes our nursing background, because we are looking at things holistically, we're looking at the whole person. So everything plays a part in their situation. And sometimes you just have to get really creative and find a way to fix some of those problems. And it may not be a long-term fix. It may be just temporary until the family can get things together, or it might be temporary until another resource can take over. But don't think that this is smooth sailing. Different. It is different than the hospital. And yes, you don't, you're not forced overtime. You have to ask for overtime. Like if you get out with a client, you're going to be gone longer. You need to let your supervisor know. But you have to take care of yourself. That's an important part of nursing, and it's an important part for the social workers as well, because sometimes this can be not just stressful, but so sad that you have your own trauma from watching and being involved in a case, and you have to take care of yourself. It's really important that you take your vacation time, that if you're sick, you stay home. It's extremely important to know that this has just as many challenges and stresses as a hospital job or a clinic job. They're just different. And you learn a lot, and you learn more, and you build up a repertoire of resources and numbers and business cards from people that you can reach out to. And that can help you get through those negatives. But you have to hold on to the good stories, and you have to share with your colleagues and with your supervisor when you're frustrated and when you're having problems, because we all work together to serve this community. So you have to really take the time to step back and say, okay, what can I really do for this person? And learn to let yourself be forgiven if you can't fix it. because you can't fix everything, and that's okay. But you're going to be busy, so don't think you're going to be bored. In the beginning, you might be a little bored because it just feels like things, but once you hit the floor running and have a caseload, you will not be bored. There will be plenty to do and plenty of our kind of documentation, which again is not like hospital documentation. So we don't even have to do it on the same day. If you do it the next day, it's okay. You just put in the time you saw the person. So that's a big bonus. I highly recommend that if you're thinking about applying for a job like this, that you ask if you can actually talk to one of the public health nurses or one of the social workers and see what it's really like, because it's important that you know what you're stepping into. A lot of people don't, and then they get frustrated and they go on to something else. So know that it's definitely going to be stressful at times. It's going to be busy, and it's going to be extremely rewarding because you're going to learn more than you ever could in a classroom, that you ever could from a training in the hospital, because you're going to be out in your community and you're going to find things that you didn't even know existed.